Hi, I'm Dr. Arun Ghosh, and this is my top 10 myth-busting facts about fertility. Number 1. Fertility thermometers and charts. Women have often been told, normally by us doctors, to monitor their temperature, to be using digital or oral thermometers to check how their ovulation goes throughout their cycle. While these can be useful in monitoring how your cycle goes, they don't often help with fertility. They often lead to your poor partner being dragged out of work and sex only being at times when your temperature seems to be at the appropriate level. In essence, they haven't really helped, so my advice is not to waste your money. They are useful if you want to know whether you're ovulating or not, and whether your temperature is going up, but they are affected so easily by so many things, such as mouthwash, alcohol, even if you've got a common cold, that often they can be misleading. So I would say, save your money and probably spend it on a nice romantic dinner. Number 2. Fertility only happens on day 14 of your cycle. I'm afraid this just isn't true. Women's cycle can vary anywhere between 25 to 36 days, and it can differ from cycle to cycle, so not everyone is 28 days and regular. Also, you can ovulate any time from day 13 to day 18. So really, the idea of you sitting there checking your mucus and checking your temperatures is probably going to waste a lot of hours. The best advice is to make sure you're having sex roughly between day 13 to day 18. That would be the best time, but really, as long as you're having sex, then you stand a good chance anyway. Number 3. You can only get pregnant on the day that you ovulate. Look, timing is important, but it's not key. Actually, when you ovulate, your egg can stay alive in your body for up to 48 hours. Sperm can stay in your system for up to 7 days, so you actually have a week after sex where you can actually still get pregnant. The key would be to make sure you're having sex on a regular basis. Then hopefully the 2 times at one point they should both meet. Myth 4. Staying in good health will keep my fertility. Whereas staying in good health is something doctors normally tell you to do, and of course it would be the best thing to do for your fertility, it doesn't have an effect on fertility, and it certainly doesn't stop the aging process. As we get older, our fertility does decline. For most women, their peak fertile time comes in their early 20s. That may be a time when you're not thinking about it, but you should be aware by the time you get to your mid-30s, your fertility is going to start to drop. For most men, though we continue to produce sperm, you will find after the age of 40, your sperm levels will drop and the quality of your sperm will drop. Myth 5. It's all her fault. I see a lot of couples here that come in for fertility advice, and it's often the women who feel that it's their problem, and the men who just seem to be going along with it. Well, actually, guys, it's just as much our problem as it is theirs. 40% tends to be related to female problems, but 40% also seems to be related to male problems. The last 20 seems to be a combination of the two. So we really have just as much part to play in fertility as our female counterparts. Myth 6. I must stop drinking all my beer and wear pants like MC Hammer. Whereas it's true, alcohol does have an effect on your sperm count, you have to be taking it in a vast quantity for it to really have a drastic effect. Also, if you're taking it for a chronic period of time, you're more likely to be worried about your liver function and whether you've got brewer's droop than you would do anything else. In reality, alcohol taken in the normal daily units, which is about 3 to 4 for most men and 2 to 3 for most women, will have very little effect. The one thing I would say about pants is there has always been a debate about briefs and boxers, cycling or not cycling. Before you go smashing up your bike and destroying all your briefs, it has very little effect long term. The one thing to say is scrotal heat does have a part to play. Your testicles hang outside for a reason, rather than just a cruel joke, and the reason is that sperm is better produced at a slightly lower temperature. It does not mean we need to go sticking our testicles in the fridge, but it means that wearing looser fitting clothing does help increase your sperm count. Saying that, if you did start cycling, or if you do sit for long periods of time, a day where you don't would reinstate that sperm test to come back up. So all you need to do is be careful in what you're wearing. If you're about to do a test or if you're trying for a baby, try a day or two wearing slightly looser trousers and not jumping on the bike and hammering your testicles. Myth number 7. Morning sex is the best sex. I'm not really sure if this comes over the confusion how we used to tell people to give midstream urine samples. We used to advise people to make sure they gave an early morning sample of concentrated urine that had been stored over the bladder, and I think this may have gone on to morning sex. But unfortunately it makes no difference. There is no difference between your sperm sample taken early morning or late evening, or even sometimes between samples taken on the same day. So really, early morning sex makes no difference. It's the fact that you're having sex that helps. So it's not one I really want to bust, because I'm just happy that my couples are actually enjoying it. If early morning works around work and works around the children, then I would say that's the best thing to do. But if it doesn't, don't be worried. You can have sex any time. The key here, if you're not getting the picture, is you must make sure you're having sex. Myth number 8. Having daily sex increases my chance of getting pregnant, or only having sex every 3 days will make sure I get the maximum amount of fertility going on. I think the 3-day rule comes from the porn industry actually. It does increase the amount of ejaculate that you produce, but often abstaining doesn't increase the quality of your sperm. In fact, the opposite. Recent studies have shown us that actually having daily ejaculate increases the quality of your sperm. So sometimes there may be an argument to say have more sex, or if you need to masturbate, then that would actually help the quality of your sperm. Unfortunately guys, you may not like this next bit. Actually having sex on a daily basis also doesn't really increase your chances of getting pregnant. Studies have shown couples who have sex on a daily basis as opposed to couples who have sex when and as often as they can doesn't really make any difference. So the daily routine shouldn't make any part and parcel of having sex. It should fit round your life, but do remember, the more often you're having it, the better the chances of getting pregnant. Myth number 9. Women will run out of eggs. The average woman is born with 400,000 eggs. Now, most women will be grateful to know you will not have 400,000 periods. But menopause is the time when your body stops responding to the hormones, not the amount of eggs that are left. This doesn't mean that the quality of the eggs stays throughout. Everything has a sell-by date, and unfortunately, we know the quality of the eggs does deteriorate with time. As we mentioned earlier, especially after the age of 35, and again, once we get into our 40s. Guys, unfortunately the same rules do apply to you. Sperm does drop in quality after the age of 40. Now we know that you will continue to produce sperm throughout your entire lives. But again, the quality, the amount and the morphology, which is the way they're swimming, does start to drop. Myth number 10. It's all due to stress. Whereas lifestyle factors are important, stress cannot be directly related to infertility. It does decrease your libido, and as we said, not having sex certainly isn't going to help, but it doesn't have a direct effect on your fertility levels, your hormones, or the amount of sperm you produce. So really, those in stressful jobs are likely to get pregnant as those who are not. The best thing to say though is not to worry about fertility. The vast majority of times it will happen over a period of time if given that amount of time. For those that do suffer or do have problems with fertility, there is help available. The NHS may be cutting back, but the private sector is certainly getting bigger, and certainly there is also advice and good timings that you can get from your GP or family planning.